When you visit a doctor, you expect clear answers. You seek solutions to your health concerns. However, sometimes the path to an accurate diagnosis is not straightforward. Medical misdiagnosis is a significant issue in healthcare systems worldwide. It means a patient's condition is incorrectly identified or missed altogether. This can lead to delays in proper treatment. It can also result in unnecessary procedures or medications. The impact on a patient's life can be profound. Understanding this challenge is the first step toward better outcomes for everyone involved in the healing process. Low back pain is one of the most common reasons people seek medical attention. Millions experience its debilitating effects every single year. It can range from a dull, persistent ache to sharp, incapacitating pain. This discomfort can disrupt work, sleep, and daily activities. The search for relief often begins with a visit to a healthcare provider. Patients hope for a quick and accurate explanation for their suffering. They trust that their symptoms will be correctly interpreted. This will pave the way for effective treatment and a return to a pain-free life. The expectation is high for medical professionals to get it right. The general statistic that 10 to 15% of medical diagnoses are incorrect is a sobering thought. When applied to a condition as prevalent as low back pain, the implications are vast. This suggests that a significant number of individuals suffering from back pain might not be receiving the most appropriate care. This potential for error highlights the importance of a thorough and meticulous diagnostic process. It is not enough to simply acknowledge the pain. Understanding its precise origin is paramount. Every patient deserves a diagnosis that is as accurate as current medical science allows. This is the foundation for effective treatment. The human lower back is an intricate structure. It comprises vertebrae, intervertebral discs, facet joints, ligaments, muscles, and nerves. All these components work together to provide support, flexibility, and movement. However, this complexity also means that many things can go wrong. A problem with any one of these structures can lead to pain. Sometimes the pain felt in the back might even originate from an entirely different part of the body. This is known as referred pain. Identifying the specific pain generator requires skill and careful consideration of all possibilities, making it a truly challenging task for clinicians. Given this complexity, healthcare providers often use the term non-specific low back pain. This label is applied when a clear, specific pathological cause, like a fracture or infection, cannot be readily identified. While it is a recognized diagnostic category, it essentially means the exact source of the pain remains elusive. For many acute cases, the pain resolves on its own with conservative care, regardless of a precise structural diagnosis. However, for chronic or persistent pain, a non-specific label can be unsatisfying for patients. It can also hinder the development of a targeted treatment plan. While non-specific low back pain is a common diagnosis, it is crucial to ensure it does not become a catch-all term that masks a more specific treatable condition. Continued investigation may be warranted if the pain persists or worsens. Relying too heavily on this label without thorough evaluation can lead to generic treatment approaches. These approaches may not address the patient's unique underlying problem. This can result in a cycle of temporary relief followed by recurrence of pain. Patients may feel unheard or believe their condition is not being taken seriously enough by their medical team. One of the major contributors to misdiagnosis in low back pain is the overuse of diagnostic imaging. Technologies like X-rays, kinetic scans, and MRIs are powerful tools. Advanced imaging, unlike X-rays, in the early stages of uncomplicated low back pain may derail proper identification of the pain source. Studies, including notable work by researchers like Richard Deo, have shown that advanced imaging often reveals age-related changes. These changes, such as bulging discs or arthritic joints, are common even in people without any pain. Attributing pain solely to these incidental findings can lead to incorrect diagnoses and unnecessary interventions, including surgery. Another significant factor is the under-recognition of non-spinal causes of low back pain. Not all pain felt in the lower back originates from the spine itself. Various other medical conditions can refer pain to this region. These can include kidney problems, such as infections or stones. Pelvic issues like endometriosis or pelvic inflammatory disease in women can also cause back pain. Vascular problems, such as an abdominal aortic aneurysm, are less common but serious non-spinal causes. Failing to consider these possibilities can lead to critical delays in appropriate treatment for the actual underlying condition, which can have severe consequences. Gender bias can also play a subtle yet impactful role in the diagnostic process for low back pain. Research across various medical fields has indicated that women's pain is sometimes more likely to be dismissed or attributed to psychological factors like stress or anxiety. This can lead to a delay in receiving a thorough physical evaluation or appropriate diagnostic tests. When pain symptoms are not taken at face value, the opportunity for an accurate and timely diagnosis diminishes. It is essential for healthcare providers to approach every patient with equal attention and an open mind, regardless of gender, to ensure equitable care. These contributing factors, overuse of imaging, under-recognition of non-spinal causes, and potential gender bias, can create a perfect storm for misdiagnosis. When combined, they can lead patients down a path of ineffective treatments, prolonged discomfort, and escalating healthcare costs. The frustration of not knowing the true cause of one's pain, coupled with treatments that don't work, can take a significant toll on a patient's physical and mental well-being. It underscores the critical need for a more discerning and comprehensive approach to diagnosing low back pain from the outset. The paramount importance of an accurate diagnosis for low back pain cannot be overstated. A correct diagnosis is the cornerstone of effective treatment. It ensures that interventions are targeted at the true source of the problem rather than merely managing symptoms. This not only increases the likelihood of successful outcomes, but also helps prevent the patient from undergoing unnecessary, costly, or potentially harmful procedures. When the diagnosis is right, patients experience faster relief, reduced disability, and an improved quality of life. It stops the cycle of trial-and-error treatments that often characterize mismanaged back pain cases. A precise diagnosis allows healthcare professionals to develop a tailored treatment plan. This plan can address the specific biomechanical or pathological issues contributing to the patient's pain. For example, if the pain is due to a specific muscle imbalance, targeted exercises can be prescribed. If it's due to nerve compression, interventions to relieve that pressure can be employed. This specificity is far more effective than generic advice like rest and take pain relievers. It empowers patients by giving them a clear understanding of their condition and a structured path towards recovery, fostering a sense of control. At centers like Bethesda Spine Posture, the focus is squarely on achieving an accurate diagnosis from the very beginning. Their team of experts understands the complexities of low back pain. They employ a comprehensive evaluation process that goes beyond just imaging. This includes a detailed patient history, a thorough physical examination, and functional movement assessments. They take the time to listen to patients and consider all potential contributing factors. This meticulous approach significantly increases the chances of identifying the true root cause of the pain, setting the stage for effective, individualized care and long-term solutions. In conclusion, navigating the complexities of low back pain requires a commitment to evidence-based guidelines and thorough patient evaluation. The risks of misdiagnosis, fueled by factors like premature imaging and overlooked non-spinal causes, are too high. Adopting a patient-centered, comprehensive diagnostic strategy is essential. This ensures that individuals receive the correct diagnosis, leading to effective treatment, reduced suffering, and optimized healthcare resources. Places like Bethesda Spine Posture exemplify this commitment, offering hope and real solutions to those struggling with the challenges of low back pain, ultimately guiding them toward sustained well-being.